Hello everyone, this is Dr. Mark Shafik here at ExpedientMed.com, our telemedicine company that's currently available in Hawaii. Today's topic is a discussion regarding high blood pressure, which is commonly referred to as hypertension. Now, if you do have high blood pressure, it pretty much means that the force of the blood pumping against the arteries, they're consistently high, causing the heart to pump much harder or work harder. Now, the normal blood pressure reading is under 120 over 80. So it should be below 120 on the top number, below 80 on the bottom number. Now, pre-hypertension or patients who are at risk for high blood pressure, the reading is typically on the top 120 to 129 over the bottom, which is usually under 80 still. However, on stage 1 hypertension, the blood pressure typically is around 130 to 139 over 80 to 89, and then stage 2 is 140 over 90 or above. Now, a blood pressure reading, let's say of 180 over 120 or higher, that's a problem. That's usually considered hypertensive crisis. You really need to seek medical care immediately. Now, many times people don't even realize they have high blood pressure. They're asymptomatic. But sometimes people do complain of headache, shortness of breath, and sometimes nosebleeds. Now, there are two forms of hypertension. There's primary hypertension and secondary hypertension. Now, primary hypertension, usually there's no identifiable cause. It's just something that starts to develop over years, maybe some plaque buildup. You tend to get higher blood pressure. Now, secondary hypertension is typically secondary to certain conditions like adrenal gland tumors, medications that sometimes people take for cough and congestions that have those stimulants in there, illegal drug use such as cocaine or amphetamines. Sometimes people will have kidney disease, obstructive sleep apnea, or even thyroid problems, and those can cause the blood pressure to be elevated. Now, people who are at risk, anyone who gets older, we all start to get high blood pressure. The Black population tend to have it at an earlier age than the white population. If you have family history, you're at increased risk. Obesity or high weight, lack of exercise, tobacco smoking usage, low potassium levels, and you probably wonder why low potassium levels, because it actually regulates the balance of amount of salt that's in our blood cells. Drinking too much alcohol, stress, and other chronic conditions can also lead to high blood pressure, including pregnancy as well. Now, some of the complications could include heart attacks or strokes, aneurysms, heart failure, kidney failure, eye problems, changes with memory, and dementia. Now, to treat this, you'll definitely need to consult your primary care physician, because there are medications that will help, but also lifestyle changes, not smoking, limiting alcohol use, losing weight, controlling your diet, eating more of a heart-healthy diet, and things like that. So although we don't chronically manage high blood pressure at our telemedicine company, we do understand that people may have issues filling their medications sometimes. So if you need a refill, you can definitely contact us. That will help you get by until you can see your primary care doctor. Or if you're worried about that and you think you might have it, you can always consult us as well at ExpedientMed.com. We're always here to help. All right, everyone, I hope this helps. Take care, and we will definitely see you next week for the next topic. You guys take care. God bless. Bye.